the pandemic has obviously wreaked havoc with acute morbidity and mortality. But the fact that it's affected our preventive health is really going to have long-term effects. Just some of the data is telling us that cancer screenings are way down. According to the number of mammograms being done, we had 1 million fewer mammograms in the first 8 months of 2020 as compared to the year before. That doesn't mean people aren't getting cancer. It just means it's not being diagnosed early enough. Of course, heart disease screenings are down, diabetes, high blood pressure, all of the chronic disease management is affected. So as much as we want to flatten this acute curve, we also have to flatten the chronic curve, which is continuing to rise unless we really take care of our preventive health. It's absolutely critical that all of us get vaccinated. But in addition to that, we need to focus on our preventive health because remember, 1 out of every 20 of us that get vaccinated may still end up getting severe and symptomatic COVID. And therefore, we have to work to mitigate and reduce those other risk factors that can increase our risk with COVID, such as obesity or high blood pressure or heart disease. So preventive health is really a package, and vaccination is an important part of it. But getting screenings and making sure you're staying on top of your preventive health is the important other part of it. Certainly, there's a small amount of risk with leaving your home, but going to a place like a Quest Patient Service Center where everybody is wearing protection, everything is sanitized, you're spending minimum time there. You're going in and out for an appointment. And weigh that against the risk of postponing your preventive screenings, particularly if you're somebody who has a history of heart disease, diabetes, high blood pressure, or other cardiometabolic risk factors. So I would say for most people, it's a small risk to go to the patient service center, but it's a big payoff to really get your preventive screenings on time. Head to 9 Health, where just for $39, you can check 28 different levels of health and really get a good snapshot of what your heart disease risk is, what your diabetes risk is, what your thyroid function is, what your electrolytes are doing, and many other different factors.